Hello, and welcome back to the channel. Well, as always, it's your public health safe space. I'm Dr. Nell, and we're going to have another discussion. Today, we're outside and we're just people watching. We're going to do a little people watching. We're going to talk a little bit. So, we're watching the men work. They're doing some construction, building a new mall, and I decided, why not? Just sit around, turn the camera on them, and let's have this conversation. Now, I remember growing up in the Caribbean, everybody has that scary story. My dad was my scary story. And the topic we're talking about, before I even go into my story, the topic we're talking about today is teen pregnancy and the public health and lifetime impact teen pregnancy has. Now, I remember we used to have grandma, grandpa, and everybody talking about staying away from the boys. And if you touch the boys, you're going to get pregnant. And if you stand around and talk to the boys, you're going to get pregnant. Well, my dad took it to a whole different level. And let me tell you, he had me so intimidated, I didn't even want to think about children. My dad had this thing. At the moment I turned maybe 14, 15, he would remind me, we had food markets in the Caribbean. And if you watch the videos, I'm from Jamaica, you could hear my accent. Can't fade it, can't hide it. Hello, my Jamaican people. Wagwan. Yeah, so back to the story. My dad did not give me the conversation about, preventative and using condoms. It wasn't that conversation in my house. My dad literally scared the mess out of me, and his way of doing it, his teen prevention conversation was, if you get pregnant in my house, I'm taking you out of school, you're going to the market, you're going to sell onions and thyme and scallion and yams and potatoes, and you're going to watch your friends go by, and of course they won't buy from you because you're the student who got pregnant. Now, it sounds simple enough and it may sound funny to some, but for me, that was a major blow. I remember the first time he said that to me, he said, if you think I'm joking, watch. And he said it to me, we had that weekend coming, and I don't remember what was going on, but my dad, we used to go shopping in the market. He took me to the market and decided I would spend 2 hours with a cousin of mine who was a vendor. And yes, it was embarrassing. He said, you're going to spend 2 hours and see what it's like if you turn up pregnant. And it was the most difficult 2 hours helping to sell yam and tomatoes and cucumber. And that scared me straight. So today we're talking about teen pregnancy because those days of scaring teens straight are gone. So we're putting the information out there, and drop your scary story in the comment section. What did your parents do? I'm not going to age myself. For those who are 70s, 80s, and 90s babies, what did your parents tell you to make you stay away from interacting and avoiding teen pregnancy? Now, I always start with a hook. So here goes the hook. A girl is still growing, her bones are still developing, her brain is still maturing, and then pregnancy happens. What does that do to her body? We're not just talking about the emotions. Of course, it's chaotic. She's going to cry. She's going to not know who to talk to. But we want to look in, what does that do to her body? So it's not just socially, but physically and for the long term. We're breaking down the real health and life impact of pregnancy in teenage mothers. What happens before, during, and after childbirth, and how we can shape not just one life, but generations. Teen pregnancy occurs between ages 14 to 18 and is more than a social issue. It is a public health concern. And although we talk with the story, we're going to have a few laughs, it is a serious thing. According to the CDC, that's the Centers for Disease Control and Prevention, adolescent mothers face higher risk of complications compared to adult women. And of course, it makes sense. Their little tiny bodies have not matured. And the reason is simple. The bodies have not matured. That's right off the bat. You could see it. Picture a woman. Look out wherever you are. Look at a child, a 14-year-old, and a 25-year-old or a 30-year-old. You could see the difference in their bodies. A teenage body is still in a state of growing. And we said that. When pregnancy occurs for this teenager, the body is forced to divide its resources. So it's dividing resources between supporting that fetus, that mother, that maternal development, the baby's growth, and it creates a strain physically, emotionally. It creates a strain on this young woman. Now, we see physical impacts like the incomplete pelvic growth, which is increased risk of a difficult labor because their pelvis, they're not matured to that point. The nutritional depletion, where a mother has to support and feed the baby. So now both are at risk. The hormonal imbalance, that's that emotional stuff where we're talking about where your emotions affect your physical health. These things can lead to serious conditions while pregnant. We're talking about preeclampsia, anemia, even preterm birth. So you want to know why prenatal care is critical, especially for teenage mothers. It is not optional. It is essential. Organizations like the American College of Obstetricians and Gynecologists, they emphasize early and consistent prenatal visits, especially for high-risk groups like teens. Prenatal care, when your mother goes to the provider, that prenatal care provides monitoring of blood pressure and the development of the fetus, that baby, nutritional guidance for that still growing body inside you. But for teenage mother, it's also nutritional guidance for them because they're still growing. So we have two growing bodies that we're providing guidance to. Screening for complications that could arise early, because this is a young person, a person whose body is not ready for this change, as well as emotional and mental support. Without that prenatal care, of course, their risks are going to increase significantly. We'll have low birth weight in babies. We'll have birthing complications for mothers and undetected life-threatening conditions. And yes, life-threatening. We could also have loss of life, whether for one or for both. There are risks that occur also during delivery. Teen mothers face a higher risk during childbirth due to their physical immaturity. Again, we're talking about that pelvic area. The common complications that we see here are prolonged labor. No, I wasn't a teen mother. No, I had my first child at 27, and I remember at 27, my labor was 36 and a half hours. And you know, Caribbean people, my mom walked in with that time tea. People, can I tell you time? That THYME that we use to season meat or put in our rice and peas. Oh, they made tea for me. And that time tea did not help. 36 and a half hours. So for our teenagers, me being 27, 36 and a half hours, it doesn't have to be the same for everyone, but I am saying for a teenager, there's more complications. Prolonged labor, obstructed labor due to that smaller pelvis to push that baby out, increased likelihood of emergency interventions like C-sections, of course. Now, this can lead to birth trauma, higher rates of cesarean section, that C-section that we just mentioned, which is more likely in teenage pregnancies, and injury to the mother's body, temporary or permanent, it is still injury. In some cases, these severe complications can lead to future reproductive issues. Or we have a lot of women who have children as teenagers who are not able to have any more. Can you just imagine? Now, after the baby is born, the risk does not disappear. And this is the most important part of the conversation, because we take for granted, oh, she was a teen mother, she had a healthy baby, she'll be fine. Not necessarily. Do not take that for granted. Postpartum care is often overlooked, especially in a family where there are financial constraints. We cannot overlook postpartum care, especially for teenage mothers. Overall, you shouldn't, but especially for teenage mothers. That's our focus today. There are postpartum risk, postpartum depression. We have physical recovery complications because that body has to heal. The uterus has to come back to its normal size. There's hormonal instability, and there's often lack of a support system for teenage mothers. A lot of times, especially in Caribbean households, the family is so angry at the teenager that they don't even think about the support, the emotional, physical, and financial support that this teen needs. And teenage mother is not just caring for a newborn, she's still developing herself. And so postpartum depression and sadness, because here she is now having a baby and she looks at her friends are still going to school, they're having a good time, they're going out, and here she is with a baby. So there's a lot of emotional support that is needed for teenage mothers. Pregnancy at a young age can have long-lasting effects on the body. We have cardiovascular risk. Yes, there is cardiovascular risk. Teenage pregnancies has been associated with increased long-term risk of high blood pressure and heart disease. Because, high blood pressure and heart disease almost correlate. And the heart disease usually occurs later in life. But where it starts, there, teenage pregnancy. There's physical and nutritional impact. We have bone density loss due to calcium depletion because that baby's taking. So the mother has to get that nutritional care, that prenatal medication, everything she needs, and the baby's taking. Plus, you are already a young child with a body that's developing, bones that are still growing. There's chronic fatigue and weakened immune system. There are so many things that go into giving birth, and the risk is even higher for teenagers. Now, that mental health impact, that postpartum depression, it's important that we talk about it because there's increased risk of depression and anxiety. And this interrupts identity development. Teenagers are trying to figure out who they are, and put on top of that a newborn, a struggle, a depression, tears, crying, not knowing what your future holds. And really, adding the baby's tears to your tears is a lot of emotions that come into play. Because babies cry. They don't know any other way to communicate but to cry. So organizations like the World Health Organization recognize adolescent pregnancy as a major contributor to long-term health inequities. Yes, being pregnant as a teenager has long-term health impact. This is where the conversation begins to expand beyond just health, but into our life trajectory. Teen pregnancy can significantly affect a young mother's future. We're talking about their educational impact because most mothers fall out of school at that point, and seeing going back to school becomes almost a challenge or a burden for some people. The higher likelihood of dropping out of school is there. There's a reduced chance of completing higher education. So most mothers don't even finish to get their high school diploma, which limits their job perspectives. There's limited access to career building opportunities without these high school diplomas that are needed. And some countries don't have the GED system like America does. When education is interrupted, earning potential is directly affected for the long-term future. The economic and financial impact is increased, and the likelihood of long-term financial instability is almost inevitable. There's a greater dependence on public assistance, if your country even has public assistance for teen mothers. Limited career mobility, because they are now caring for a child, which is an added responsibility. Your productivity within the society is also reduced, because when a young woman is unable to fully develop her education and career, it impacts workforce participation and long-term economic growth. So all these things are happening with a teenage mother. And so it's very impactful to care for them, not just abandon them. Yes, they've made oftentimes unplanned decisions. Some people label it mistakes, but no child is a mistake. They've made this decision. Do not abandon them. The effects can extend to the newborn. There's a higher likelihood of developmental and educational challenges for our newborn as they grow up and go to school. There's an increased risk of growing up in a low-income environment, and we know low-income environments impact healthcare overall. So there's the impact of healthcare for the mom as she grows, and there's the impact of lower healthcare access for this child. The barrier to consistent healthcare and academic support goes for both the mother and the child. There are two possible paths that we consider here. With support, there is returning to school. Now, it's important for us to understand that these two paths that can occur, with support, we have returning to school for the mother, access to childcare, strong family and community backing, improved long-term outcomes. But without support, we have interrupted education, financial hardship, limited opportunity, and generational cycles of disadvantage. Yes, generational cycles. We notice that teenage mothers, those children oftentimes become teenage parents themselves, and that is a fact. This is not just about one pregnancy. It's about two futures being shaped at the same time. It's important to note that. Teen mothers need support and not judgment. Now, families and communities can help, and they must help. They must ensure access to prenatal and postpartum care, provide emotional support and stability, encourage continued education, and connect your family members, these teenagers, to healthcare and social resources. That's very important. Providers, what I want providers to understand and what providers must do is treat teen mothers with dignity, screen for physical and mental health risk, provide continuous and long-term care while supporting the changes and the outcome for these mothers. It's very important. There are some mothers who have told me as teen mothers, the doctors were most judgmental, so they never kept up with their prenatal appointments. We don't need that. Prenatal appointments and postpartum care is important. Now, you want to know where to get help, and that's important. I cannot just give this information without telling you where to get help because we're advocating. So if you are someone you know is a teenage mother, support is available. Healthcare and support services. We have Planned Parenthood, which deals with reproductive and prenatal care. March of Dimes deals with maternal and infant health resources. And the local health departments and community clinics do the same and will guide you in the direction. We have food pantries who also provide support nutritionally. This is important. I know a lot of people take their pride and don't want to go to the food pantries. Go to the food pantries. They're there to help. Nutrition is important with or without pregnancy, but more so with pregnancy. Now, there's mental health support. I've spoken about this so many times. 988, suicide and crisis line. You could call or text them. School counselors and community programs. Yes, they're available. Use them. Put your pride aside. A healthy mother, a healthy child. That's the priority. So the step-by-step guidance here. Confirm pregnancy with your healthcare provider. 1. Begin prenatal care immediately. Can I say immediately? Begin prenatal care. Follow medical and nutritional guidance. Develop a safe delivery plan. Talk to whoever your parent, whoever is providing that support, the parent, the father, the grandfather, the best friend, the neighbor. Create a plan. Attend all postpartum visits. Now, if you need mental health support, please get it. And you don't have to wait till you need it. Make it a part of your prenatal care and the plan to get that support so that you are able to see yourself through this feeling stronger and more prepared and equipped emotionally. Create a plan to continue your education and training. In Jamaica, I know they have Art Academy. In the US, you can get your GED still. Please find the community resources and use them. They are there for you. Build a strong support system. A teenage mother is still a child, and so they need our support. Financially, emotionally, they need our support. And now they are cast to raise another child. So it's a child raising a child. Her body is still developing. Her future is still forming. And yet she is still asking and being asked to carry life. So if you support life, and if you are one of those people who are against abortions, please support your teenage mother and their care. Support your local community resources. Donate to the food pantries. Volunteer at your clinics to support these teenage mothers. The decision has been made, the action was completed, and there's a child on the way. Do not punish the mother or the newborn. This is why awareness matters. This is why your support matters. Because when we invest in the health of our teenage mother, her education, and her future, we are promoting success. We are not defining anything as a mistake, but we are promoting and guiding towards success. We don't just change one life, we change generations. Thank you for being here. I hope this opens your heart. Let's have the conversation in the comment section. Were you a teenage mother? How did you cope? Are you supportive of teenage mothers not becoming a teenage mother, but once they're in that cycle, that dilemma, that challenge, are you supporting them, or are you casting them aside? We do not need to cast anyone aside, because we don't know the future and what it holds for our children. Support them, motivate them, be that inspiration that they need. Thank you for being here, and have a wonderful day, whatever your task is for today.